Hey, y'all. Hey, greetings and welcome. I am Dr. Cherry Estelhomme, and I will serve as your instructor for this semester. This semester, we are going to be dealing with Counseling 645, Crisis, Trauma, and Grief Counseling. We'll be directly using much of the information from our assigned textbook, which is Crisis Assessment and Intervention and Prevention by Jackson, Cherry, and Erford, the 3rd edition. All right, well, let's get started. So this chapter, we're going to look at with understanding what a crisis really is, the background, the statement of the problem, purpose and significance, as well as looking at situational crisis. We're also going to touch on the crisis intervention theories, some really popular ones like acute grief and preventive psychiatry, as well as brief therapy and some other domains. All right, so I wanted to start with just taking a look at some random pictures. So I want you to look at these pictures and I want you to kind of jot down thoughts that come to your head when you look at this picture and what's going on. Here's the next one. I want you to take a look at the things. And I want you to, in your mind, create a story of what you think is happening here. Things that are said and unsaid, things that you see and don't see. Okay. What is this picture telling you? What does this say? This one, people say that pictures can say 1,000 words. So what are some of the things that you see? What are things that you don't see? What are some of your perceptions about what is going on here? Okay. Let's take a look at this one and see, what do you think is going on in this picture? So let's talk about it. When you take a look at each of these pictures, I want you to take a look at them and try to gather in your mind what you believe is happening. And then I want you to be mindful as we go through this lecture that although what you might believe what is happening, that may not be the actual truth that's on the scene, because you're looking at it from the lens of your experience, your culture, and your background. Whenever you come upon a traumatic situation, you want to make sure that you find out from the client or the person that you're working with, what do they experience this to be? Of course, you don't want to ask some of the basic questions like, how do you feel? You want to stay away from some of those, but you do want to take time to not see it just through your lenses or just through your experience. And you want to take time to make sure you actually find out what this particular client may be experiencing and how they are perceiving what's actually just happened. So let's look at the basic definition of a crisis, right? So a crisis is an event, right? It's an event that may or may not cause a disruption in life, okay? It's an event that may or may not be perceived as a disruption in life. But the biggest thing is a crisis does not necessarily lead to trauma. Okay, it's an event that may or may not be perceived as a disruption in life, and it does not necessarily lead to trauma. All right. So when trying to determine if something is a crisis, you want to look at these 3 specific things. It has to be a trilogy of things in order for it to be determined as a crisis. All right. These things together will determine if it is a crisis. The first thing is the precipitating event. What happened? Something happened. Again, that goes back to our original definition that a crisis is an event. It starts with something happening. The second part of the trilogy event is the perception of what happened. Did the person perceive this thing in a subjective, distressing manner? Okay. What happened, the precipitating event, and then the perception. How did the person determine it? And then the final part in the trilogy is the diminished functioning due to coping, right? How is this person able to function in the midst of this stress or distress? Keep in mind, everyone copes with things differently. Perception is one thing, but how they view it and handle it, how their functioning goes forth, determines the whole trilogy effect. And so if your normal ways of coping are not working, your normal ways of coping, like taking a deep breath, counting to 10, praying about it, having the resources to get through it. If these normal ways of coping are not working, and you have all these three things combined, the precipitating event, the perception leading to subjective distress, and the diminished functioning. If you have this trilogy of, of items together, then that's when you can look at and determine that this may actually be a crisis. Okay. I want to read the actual definition that's in the textbook. James and Gillian from 2017, they define crisis as a perception or an experiencing of an event or a situation as an intolerable difficulty that exceeds the person's current resources and coping mechanisms. Okay, I'm going to repeat that. It's a perception or an experiencing of an event or a situation as an intolerable difficulty that exceeds the person's current resources and coping mechanism. So that's how James and Gillian actually define a crisis. So let me kind of give you a couple of examples how two different people can perceive an event in a different manner. So let's say you have two people and both of their homes burned down. Lady A has experienced a house fire, everything is lost. Lady B experiences a house fire, everything is lost. However, Lady A, in this house, she does not have homeowners insurance. If she's renting, she doesn't have renter's insurance. She doesn't have the financial means to relocate, to get a hotel, to rebuild, to, get all those items, replaced. This was pretty much everything she owned, everything she had, it was in this house, and now everything is gone. Whereas Lady B has great homeowners insurance or great renter's insurance. She has the financial capability to go stay in a hotel, to relocate, get a new apartment, get a new home, build a home up from the ground up, replace the items that were not of significant, memories or values, but replace the material items, health as well. And so the house burned down was just perceived as a loss of a thing for Lady B. Whereas for Lady A, the house burning down was perceived as an absolute devastating crisis. It felt like rock bottom. I have nowhere else to go. I don't have anything else. I have lost everything. Whereas Lady B can recognize the loss, but she also recognizes the loss as something that can be replaced. Okay, so you got to take a look at how a person perceives the event. So before we move on to talk about crisis intervention theory, I want to touch on something really important. I want you all to be aware of the difference between crisis intervention and brief therapy. Brief therapy deals with ongoing mental health problems, and the aim in brief therapy is to decrease the symptoms, whereas crisis intervention is very specific. It deals with the event and the perception of the event. Remember, all people perceive things differently. So brief therapy deals with ongoing mental health problems, and the aim in brief therapy is to decrease the symptoms, whereas crisis intervention specifically deals with the trauma. Okay. Crisis intervention doesn't have to do with ongoing mental health problems, but they're specifically target that event that we just talked about a few minutes ago, and the perception of the event. And so when you're doing crisis trauma therapy, when you're on site and you're doing therapy for individuals who may have experienced a crisis, you want to deal specifically with the trauma, right? You're not really there to, talk about childhood issues unless it's related to the trauma, but you want to specifically deal with the event, the trauma. What are we dealing with right now? And we can get to in-depth mental health therapy when the person comes for ongoing counseling. So crisis intervention theory began being studied very sincerely in the 1940s, and it is still being studied today. It's something that is still being expanded upon. But back in the 1940s, a lot of things were taking place. One of the main things that was happening was World War II. And so during World War II, these families experienced this unsettling disorganization because families were torn apart due to the war. the whole family dynamic was changing. Finances were different. Women were taking on different roles other than housewives. They had to go into the workforce to help provide for their families. And so everything that was once normal became abnormal, and it caused a new normal, right? In counseling, we use that term a lot, new normal. And so this had this snowball effect of crisis and trauma due to the war in the 1940s, which led to the psychological study of crisis intervention theory. Another thing that happened besides World War II, which was a very powerful precipitating event, was the Coconut Grove nightclub fire. This was a fire that took place in Boston, Massachusetts, where over 500 people died in this nightclub, in this fire. And so a lot of mental health studies looked at how this community dealing with this tragic and massive loss, how did they deal with this? 500 people died in this fire. How are loved ones and friends coming together to support one another and to deal with this unusually high amount of grief, this universal concept of grief, because so many people are grieving at one time. And when they started looking at the psychological event of the Coconut Grove fire, they began to look at things like, what is the person's past experience with crisis? How are they individually and collectively dealing with this crisis? What resources are available to them? What community resources are they able to tap into? How are they dealing with this massive loss? So this tragic event sparked an unusual amount of studies and interventions that really jump-started the crisis intervention theory movement. As a result of this fire, 2 individuals were pushed to the forefront of the psychological analysis of this fire, Eric Lindemann and Gerald Kaplan. And you're going to want to know those names, know those names, because they're really like the founders of the crisis intervention theory movement. And so when you look at crisis intervention theory and the crisis intervention movement, you'll see Kaplan and Lindemann as these forerunners who began to look at how do you effectively deal with and how do counselors effectively help communities that are in crisis. So Eric Lindemann was from the 1900s to 1974. He was actually a professor of psychiatry at Harvard Medical School, not Harvard University. He was a professor of psychiatry at Harvard Medical School. And he came up with a way to study psychological and emotional reactions after crisis events happened. So he did all the study around people who are dealing with acute grief. He pretty much spearheaded this notion that people in these traumatic events may need long-term care. He also looked at some common clinical features like somatic distress, feelings of guilt, disorganization. He looked at these things as they are dealing with this traumatic loss and how they are building their lives after the fact. And then you also have, and Eric Lindemann was pretty fundamental in, coming up with the basic crisis theory. And then you also have Gerald Kaplan. Gerald Kaplan is the originator of the modern form of mental health consultation. He was a child community psychiatrist. He was from England, and he was born in 1917, and he created preventative psychiatry. So Eric Lindemann is known for basic crisis theory, whereas Kaplan is known for preventative psychiatry. So let's kind of take a step back a little bit and look at how Lindemann and Kaplan kind of piggyback off each other. So Lindemann and Kaplan, they were colleagues. They created a project known as the Wellesley Project, and it was a community-wide program in Massachusetts. The goal of the Wellesley Project was designed to help a lot of clients deal with acute grief, mainly due to the preoccupation with these images from this horrific and traumatic fire that took so many lives. So because of this fire, they created this Wellesley Project. And again, it was designed to help clients deal with acute grief. And so again, that's how we spearheaded into the preventative psychiatry from Gerald Kaplan. And what preventative psychiatry does is it looks at how people are experiencing traumatic event and how they get a chance to have early intervention where they can deal with these events better, right? So preventative psychiatry is dealing with things head on and even giving people coping skills beforehand. The theory was that preventative intervention would promote positive growth and well-being. So following this, Lindemann created what we know as basic theory. And his goal here was to make basic crisis theory an independent and a specific part of trauma, of crisis trauma and crisis intervention. So since Kaplan and others have built upon this basic crisis theory and this kind of concept of where we are today, it shows that the field of crisis theory and crisis trauma is still ongoing and it's still evolving. And that's kind of where we're going to get into today when we look at some of the different crisis models that are used to address crisis trauma and crisis intervention. So let's take a quick look at Beverly Raphael. Beverly Raphael coined the phrase PFA, psychological first aid. Her landmark contributions and insight are anchored in the field of grief, loss, and bereavement. So she built upon Kaplan's theory and she created psychological first aid in Australia after a horrific train accident. With her psychological first aid, she really advocated for comfort and consolation of the bereaved families. She also advocated for reunification with loved ones, those who survived the train accident. And she really offered support for those who really wanted to express their feelings right there on the spot. And so with psychological first aid, her goal was to give immediate care to those that were experiencing or lost loved ones due to horrific and traumatic events. And so Raphael suggests that PFA consists of a number of processes that may be summarized pretty much like this. Number one, meeting basic physical needs such as physical protection, establishing a sense of security, provision of physical necessities. Number two, meeting psychological needs such as consolation, emotional support, behavioral support, emotional ventilation, fostering constructive behavior. Number three, fostering social support, such as a reunification of victims with friends or family, utilization of acute social community support networks, and then finally, number four, fostering ongoing care, such as triage and referral for those in acute need, as well as referral to subacute and ongoing support networks. Right. So one of the biggest things for Raphael was she was advocating for those who were in immediate trauma to get immediate care, because often we forget that those who are in immediate trauma, before they can talk about their feelings, they need to be able to acknowledge that they're cold. They're standing outside, their house is burning down, they don't have any clothes on, and they're cold. It's what's immediate. Before I can get to what you've lost and how you're dealing with it, what need can I address immediately? And so for Raphael, she was looking at this as if people are so traumatized that they can't deal with basic problem solving skills, and that you have to know how to deal with psychological first aid in order to get them to a place where they can effectively share how they're experiencing this trauma. All right, so Beverly Raphael is a powerful person, and PFA is a great tool that you might want to become very familiar with. Just keep in mind that we have to remember that the goal is the outcome of the crisis event and not the event itself. It's the goal. The goal is the outcome of the crisis event, not the event, but the outcome of the event. How can we get people to perceive this in a healthy manner? Now, let's be clear. There are some things that are extremely traumatic, and no matter how you look at it, they might be extremely harmful, but we can still do immediate care and counseling and trauma intervention in order to help them get from the crisis to a healthy space of being able to live their life with coping skills. All right, so the last thing I want to discuss in this particular video is crisis theory or crisis domains, applied crisis theory and the different crisis domains. There are 4 crisis domains that you will need to become very familiar with. And they're in no specific order, but developmental crisis, situational crisis, existential crisis, and ecosystemic crisis. A developmental crisis occurs when people get married, have children, have a child start school, have a teen going through puberty, have a child leaving home, have parents retiring, aging, or dying. Some of these changes are subtle and gradual, and others are very abrupt and dramatic. These crises are often viewed as normal events, and thus you may not be aware of the stress on your family. Adapting to the leaving or adding of a family member or the changes that occur as children and adults grow and age can be very difficult for a lot of families. These normal developments can cause stress because they can be stressful events as the family dynamic is rearranged. To adjust to a developmental crisis, families often need to adjust to rules and roles that each individual family member once played. Every family must change as their youngster approaches puberty to become mature adult teens and gradually get more practice in making decisions. Just think about, if you have a license the first time you started driving and your parents or a guardian, someone taught you how to drive. So you went from being very dependent on your parents and guardians to now being in a place where you possibly can navigate the world by yourself and drive by yourself. So the family dynamic is changing as you, the person, or as other people in your family are growing and getting older. Right. I have a son and he's growing up way too much. And we've kept the tally chart of his height all throughout his life. And I could not come to terms with when he was taller than me. Now don't laugh. I know I'm sitting, so you can't see me, but I'm only 5'4". My son is almost 6 feet and he's still a teenager. I'm not ready. but it could have become an actual crisis for me because the thought that he's getting taller reminds me that he's getting older and he's soon going to be leaving the house. And so my role as his parent, protector, and all that is changing. I'll forever be his parent, but pretty soon I'm not going to be able to cook him dinner. Pretty soon he's going to go off to college, and his height is a reminder that he's growing and he's becoming too big for the nest, and that could be a developmental crisis. A situational crisis has a lot to do with unexpected catastrophic events like a terrorist attack or even a personal traumatic experience like a sexual assault. A situational crisis can also be something like a job loss or a health decline, a sudden illness. Those are things that are usually unexpected and catastrophic. And then you have an existential crisis, and that has more to do with meaning and purpose. Oftentimes people relate it to religion, but it's not always about religion. There are people who are atheists who can still experience an existential crisis. They may be dealing with something that has a lot to do with, what is their goal? What is their purpose in life? And then lastly, you have an ecosystemic crisis. An ecosystemic crisis is a natural or a human caused event that impacts a large segment of the population or environment. And it often has a negative psychological impact. So things like weather-related disasters, earthquakes, war, terrorist attack, COVID-19, these things, these epidemics, or even severe economic conditions will be, examples of an ecosystemic crisis. So whenever you're dealing with a client, you want to make sure that you are aware how they perceive the event. Now, keep in mind, people can perceive the event in more than one category, right? And so you can have somebody dealing with an ecosystemic crisis like COVID-19, as well as a developmental and situational crisis, meaning they have a 90-year-old parent who is already aging and old, maybe living in a nursing home. So they're already aging out, and their demise seems close because they're sick or anything like that, or they have a low immune system. So now you have this developmental crisis combined with this ecosystemic crisis of COVID-19. But then you have the situational crisis where they just die. Like their health might have been declining, but you didn't think they were going to die today, but because of COVID-19, they actually died. I can actually give you another example of something like that. Of a situational crisis and an ecosystemic crisis. There's a young person I know who was under the age of 35, healthy, vibrant person, and all of a sudden contracted COVID-19 twice. It might have been once, but he had to go back to the hospital twice. And the second time he went in, he didn't come out. He passed away. And so that was a really, really horrific situational crisis. This is somebody that was very well loved, very young, very vibrant. And the messages were that young people weren't dying from this. And so everybody's in shock. His family, his loved ones, his spouse, everyone's in shock that this vibrant young person passed from this ecosystemic crisis, from this virus that is harming so many people in so many parts of the world. All right, so that's a brief overview of chapter 1. If you get a chance, log back on for the next video, and we are going to talk about the different crisis models. You're going to want to know this information because crisis models are going to be how you are going to be a benefit to your clients that may be facing crisis. Thanks for watching.